In August of 2007, I found myself ill. I went to the ER on a Friday. They said I was fine and sent me home. I went back to the ER on Monday because I was not fine. I ended up staying in the hospital for approximately 2.5 weeks. I went back to work in mid-October with approximately $54,000 in medical bills. Because I had started my new job just the month before in August, I was ineligible for health care benefits and received no pay while I was out. I wonder now if, when the doctors were working to save me, if they were wondering if I could afford their services. I shouldn't have to lose my home because I fell ill, and no one should have to go bankrupt in order to stay alive and to be healthy.
I just told Dana a few minutes ago, who's here with us, and is that she represents the face of an awful lot of people, millions of people in this country who wrestle every day with trying to manage their financial affairs in a difficult economic crisis with foreclosures and job loss and other matters compound the difficulty of sustaining the health care premiums and the cost of health care coverage. According to a recent study, 49 million people, or 28% of the population, were paying off medical debt in 2007. That's up from 21% in 2005. Give you an idea how this is hitting families. Adults who experienced medical bill problems faced dire financial problems. 29% were unable to pay for basic necessities like food, heat, or rent because of their medical bills. 39% used their savings to pay bills, and 30% took on credit card debt.
Medical bills are the major causes of bankruptcy, and this shouldn't be like this. In the greatest nation in the world, the richest nation in the world, that we are unable to provide for the health care for our own people.
This is the single most important domestic issue that we've got to grapple with, and we've got to get going on it. We can't delay, in my view. You explained to Dana Tillman about delay, or expect to people across this country who have no coverage, businesses that are struggling with cost, that we're going to delay this. There is no delay for them. They don't get to delay their bills, they don't get to delay the problems they're facing, and they don't expect their Congress to be delaying on this issue. This issue cries out for a solution.
Investment is the key for the future. Invest in the future by covering the uninsured. We can do this. This is not only an economic imperative. It's also a professional, medical, and moral imperative that we must cover all. And I again want to thank Senator Dodd and his committee for their exceptional work, for drafting the bill, starting the discussion. We are with you. Millions of other physicians and other healthcare professionals who provide services are with you. We believe this is the time, and let's seize the moment.
This is going to be a journey that's going to go on for some weeks here. We're prepared to spend the time. I've asked my colleagues on the committee to set aside the time so that we're open, providing the time for ideas to be considered, options to be considered that are going to be critically important. On the legislation we'll introduce later today, there are some gaps in it, and done so intentionally. There are no gaps in our determination, in my determination, and that of my colleagues, to have a public option, to have something done with the pay or play, to deal with the follow-on biologics. But I left those areas open for discussion, not because they're open for some sort of decision about whether or not we ought to move in that direction, but I want my Republican colleagues on the committee to know I want their ideas. I want to hear what they have to say. This is it's a bill. It's an opening step. And if you don't get serious about putting a product together, then it becomes nothing more than endless conversation without getting clarity. And so I'm hopeful and beyond hopeful that we can achieve that result. Thanks, everybody.